Hi, my name is Donnie Wallis. Today I'm going to give you a presentation on a case report of diarrhea. Here is an outline slide so that you can follow along. First, we're going to talk about some background information on the patient. Next, we will talk about the findings in the physical examination and the lab results. Then I will talk you through the diagnosis and how that was figured out. Finally, I will discuss the treatment and the outcomes. Okay, so far, some information about the case. Mr. Bob Keller and his daughter Anna came to the emergency room together, and they were both complaining of a GI illness that has been bothering them for 3 days. Both of them have had new symptoms that started today. Mr. Keller is a 33-year-old man who lives in rural Knox County. And his medical history, he said that his co-worker went home the other day with the flu, and he and his family attended a camping trip and a family reunion over the weekend. His symptoms and Anna's both started 2 days after they got home. Today he's complaining of bloody diarrhea that started a few hours ago. As for Anna, she is 12 years old. She just finished school for the summer a week ago. She also went on the trip with her family. Today she is starting to have headaches, muscle pain, and weakness. After the history was recorded, a physical exam was done. Mr. Keller was running a fever and had high blood pressure, but he has a history of high blood pressure and takes medication for it. He also had an increased bowel sounds. Anna had a fever of 102.2, a little higher than Mr. Keller. Her blood pressure was within normal range, and her heart rate was elevated. It is worth noting that she is pretty small, weighing in at 28.8 kilograms. She also had increased bowel sounds. Now I'm going to talk about the tests that were ordered and the results of those tests. First, a stool sample was taken. Once bacteria was isolated, they were gram stained and tested for the presence of catalase and oxidase. Finally, we wanted to test for motility and a specific test that may help confirm the diagnosis. A stool sample came back positive for high leukocytes and occult blood. The bacteria was identified as a gram-negative corkscrew-shaped rod. It was also tested positive for catalase and oxidase. The motility test was positive, and we found that the bacteria having a simple flagellum. Finally, a special test was used, an auger that tested specifically for Campylobacter was done, and it also came back positive. Here is an image obtained from the gram stain. Now on to the diagnosis. Here is a flowchart on how the diagnosis was made. Once we determined the patient had inflammatory diarrhea from a gram-negative bacteria, we narrowed it down to Shigella and Salmonella, E. coli, and Campylobacter. Next, we were able to rule out Shigella and Salmonella because they are a catalase negative. Finally, E. coli was ruled out because it is an oxidase negative. The motility test and the Campylobacter specific auger confirmed the diagnosis is gastroenteritis from Campylobacter. Here are some of the characteristics of Campylobacter that we have already discussed. Additionally, I want to note that Campylobacter causes 1.3 million cases of diarrhea in the United States every year. Some causes of Campylobacter include uncooked poultry dishes, contaminated water sources, and contact with people who are infected with the organism. Common symptoms include dehydration, abdominal cramping, inflammatory diarrhea, blood in the stool, and fevers. After we found the diagnosis, we needed to treat the patients. Because Anna had shown signs of clinical dehydration, she was prescribed a probiotic, a zinc supplement, and IV fluids on top of the antibiotic. She was given azithromycin, and so was Mr. Keller. She received a smaller dose due to her size. Finally, we made it to the outcomes of this section. Both Mr. Keller and Anna got to go home and started feeling better within a couple days, thanks to their treatment. They were told to come back if they started having any new symptoms. Sometimes Campylobacter can have other complications. For example, patients may develop a neurological disease called Guillain-Barré. The family was educated on the way that they could avoid getting this infection in the future. 3 ways that they can do this are by hand washing, fully cooking the poultry, and drinking safe and clean drinking water. In summary, both Mr. Keller and Anna were diagnosed with Campylobacter infection and treated with azithromycin. Anna received a probiotic, a zinc supplement, and IV fluids because she had symptoms of dehydration. Both patients made a full recovery and were asked to return if they had any lingering symptoms or new symptoms. We've reached the end of our presentation. Thank you for your time and attention.